You're welcome back. And some of you sending messages say the things that the politicians put on their manifestos defy reason. You should be optimistic and aim high, and that's what the politicians move us to. That's what they're supposed to do. Now, get value for your money in their Kwaba promo from Bank of Africa. It is on till the 31st of January 2017. Open a current or savings account and earn unbeatable commissions on your deposits. For how to participate and where, simply visit any Bank of Africa branch nationwide. Also, if your internet could speak, what would it say? You drop that junk and hop onto a better internet experience now, and that is the MTN 4G LTE, and enjoy a whopping 100% bonus when you bundle. Just get started by simply dialing *585# to check if your device is 4G compatible, and then visit any MTN service center with a valid ID card and you will be signed on. It's a better internet experience on Ghana's only 4G network on the go. Join them and say hello to the world. MTN, welcome to the new world. Now, you make it happen quick. Everything you always wanted of insurance is online. Buy, renew, and make your claims all in 3 easy steps. First, log on to starassurance.com and follow the easy steps to get your insurance online. It's that easy and quick. Star e-insurance, possible anytime and anywhere. Star Assurance, your solid partner. Heaven Insecticide has relaunched a newly improved, stronger killing formula for its products. Heaven Black Mosquito Coil and Heaven Plus Mosquito Spray now have a stronger killing formula against all flying and crawling insects, mosquitoes, cockroaches, and ants. Heaven Black Mosquito Coil and Heaven Plus Mosquito Spray have a unique sweet-scented perfume, and you can sleep in the room immediately after spraying. Heaven Plus Mosquito Spray, pleasant on humans, tough nightmare on insects. Heaven Black Mosquito Coil, Ekum Ntuntum Tim. If you're a farmer, if you're a gardener, or you are a landscaper and your headache or bother over the years has been poor seasonal yields or post-harvest losses due to short shelf life of your produce, then this is where to put a stop to that occurrence. Agric compost fertilizer, which is an organic fertilizer made from pure organic materials such as food and farm waste decomposed naturally into humus, very suitable for all agricultural purposes. Agric compost fertilizer is available in all leading agro import and dealer and distributors across the country. For inquiries, you can contact 026 40 781. Also, White Temple Agency Limited, that's where they offer you the latest technologically advanced, trendy, and durable, yet affordable stone-coated roofing tiles. Fair Roof is a luxury you can afford. All they require of you is to give them your roofing plan, and they will supply you to meet your taste. You can locate them at White Temple Agencies Limited on plot number 65 Derby Avenue on the Children's Hospital Road, adjacent to NHIS Building Arena, or their sales office branch at the Old Wager Barrier, Accra West. You can also make a contact, and that number is 0302 67 3773. That's White Temple Agency. Now, let's see if we can box together 3 of the major areas. We have looked at education, which appears to have attracted your attention a lot because your messages keep coming in. There are a lot more that I'm unable to share with our listeners and viewers. But let's look at health, the economy, and agriculture. Health, the economy, and agriculture, or health, agriculture, and the economy, all put together. Let's hear what our guests will have to say about them. But first of all, let's hear bits and pieces of what the president had to say about these areas.
And in the next 4 years, my proposal is that a percentage of the annual budget funding amount that comes from petroleum revenues should be assigned to national health insurance. This would prolong the life of the scheme and It's not only just prolonging the life of the scheme, we're also making it more efficient. We're taking out the fraud, we're introducing more computerization, bringing in new claim centers and all that. And so it will make the scheme more efficient going into the future. Under healthcare, we have achieved a lot. Expansion of Tamale Teaching Hospital, but even if you look at the indices, we're making progress. Maternal mortality rates are on a downward trend. Infant mortality is down. Child mortality is down. Under 5 mortality is down. It means that in all these major indices, we are reducing maternal mortality and all the other mortalities. We established the National Ambulance Service. We increased the number of licensed midwives between 2009 and 2015 from 500 to 2,000 within this period. Tamale Hospital expanded 400 bed. University of Ghana Teaching Hospital 617 bed under construction. Refurbishment of intensive care units. Completion of a new eye care center at Konfanoche Teaching Hospital. Refurbishment of the operating theaters at Kolebu Teaching Hospital. We've almost completed a new, only the second military hospital. The first military hospital is 37 in Accra. The second military hospital is almost completed. It will be completed by first quarter of next year. And it's in the Ashanti region. The police hospital is being expanded. And the maritime hospital in Tema will be completed by the end of this. And then 5 polyclinics in the Upper West region, which are Babile, Lambuse, Ko, Han. 5 polyclinics in the Northern region, Pandai, Tatale, Janga, Cherponi, and Karga. 5 polyclinics in the Western region, Wasa, Dunkwa, Bogoso, Nswem, Mpoho, Elubo. 5 polyclinics in Bronga, Hafon, Krankwanta, Wemfie, Kwetre, Techimentia, and Boma. An additional 5 polyclinics in the Greater Accra region at Adenta, Ashaman, Botiano, Oduma, and Sege. The sword has been cut for these ones. They've just started. And then Central Region alone is receiving 10 new polyclinics.
All right, so you heard the president. We will deal with the health, we will deal with agriculture, and we will deal with the economy. And when we are done with that, we will look at the area of the regions, 5 more regions that are supposed to be created after a commission has studied the viability of same. So in the areas of health, in the areas of agriculture, in the areas of the economy, Nana Kumia, start with you.
Thank you. I heard you mention the 5 regions.
We'll deal with that after
yes,
this.
Yes, yeah. You know, it brings out the question. You know, in 2008, John Mahama said that he will split the Northern region into 2.
I'm saying we'll deal with that subject after this.
And in 8 years, he hasn't been able. Now he says you do 5 in 4 years. It's amazing the sort of thing that we are being told. Now, agriculture. Something when you look at my brother Kojo was talking about the outcomes. When you look at the monies, oil monies that has been pumped into what is called capacity building, and you look at the monies that have been invested into agriculture, something you weep. Now, agriculture employs at least 50% of Ghanaians. And the monies that have been invested in the last couple of years, invested into capacity building. In 2012 alone, $65 million of oil money was pumped into capacity building. And you look at the money that has been pumped into agriculture, you weep. And you look at the outcome, it is no surprising. Cocoa production, which was 1 million tons in 2011, and they put into their 2012 manifesto that they were going to expand that production. And 4 years down the line, cocoa production is now 750,000 tons. You look at food imports, which has gone up about 3 times what it was in 2008. Now that tells you that, so all of this propaganda that we are being fed with on a daily basis, we have no way of going to count what they tell us, but we have a way of checking the outcome. And the outcome is so abysmal. Even cocoa production, where they made a definite promise in their manifesto that they were going to expand that 1 million, they couldn't. They couldn't even stay at the 1 million. In fact, now they've rolled back to 750,000 tons. You look at tomato production. You look at cassava, yam. All of them are going down. And food imports has more than doubled. So did we go or did we come? You look at health. We are being told now we're going to use petroleum funds, some of the petroleum funds for NHIs. The funds for NHIs that were set up by law, you will not pay. The ones that have been set up by law, by an act of parliament, the NHI levy, you will not pay. The SNIT, you will not pay. The whole of this year, Samson, they owe 8 months of arrears into NHIs. You see, the delivery doesn't match the talk. Now, we are being told that they are going to increase the number of trained midwives. They're going to accelerate it. As we speak, Samson, degree nurses and midwives from both public and private universities have not been employed since 2012, as we speak. Over 9,000 enrolled and community health nurses since November 2015 are sitting at home as we speak. The last time they gathered at Independence Square to picket. Over 2,000 qualified nurses and midwives who just completed national service are sitting at home. And then the last time they also went to Flagstaff to picket. You look at even the training cost of this entrance fee for midwifery and nursing. It's about 5,000 Ghana cedis as we speak. 2008 it used to be 350. Today it's about 5,000 Ghana cedis. And even the ones that have been trained, they are sitting at home, some of them since 2012. And then the president tells us, I'm going to increase the trained midwives as accelerated. What is that for? He says he's going to build 2 psychiatric hospitals. The one that is
going to move the one in Accra.
And then build 2 more.
Yeah.
Yeah. The one that is sitting in Accra, you can't pay feeding, provide for feeding for the inmates. You can't pay for basic medicine. That
story has not been different in this republic.
Yes.
It's been like that.
So you would have thought
over the years.
You would have thought then that you would deal with that basic problem before you promised 2 psychiatric hospitals.
You were doing new things, seeking to build health posts and stuff. You didn't finish dealing with the situation.
The new leadership that we are going to provide in Nana Akufo-Addo, you will not find this. I can assure you. But I'm saying that the track record rests with President Mahama, and that is what we should look at. I'm saying that you cannot provide feeding grants to care for the inmates that you have now, and then you say you're going to build 2 more hospitals. What is that for? You have people with mental challenges roaming on the streets of Accra, naked, and sleeping on the streets under the interchanges. You cannot make any adequate provision for them. And they say you're going to construct 2 hospitals. When the mental patients are roaming on the streets naked, you won't take them to the hospital. You say you're going to construct 2. For what? You see, so there's a complete mismatch about the reality of the delivery and what we are being told. And it's that mismatch that really we need to talk about. Because at the end of the day, we have to look at what you have done before we can decide to agree or believe what you say you will do. And when you do that audit, it's difficult. You can't release funds for NHIS. NHIS in arrears for 8 months. And then you come and tell us you are going to bring in petrol. The one that is set up by law, you can't comply with it. So it's a terrible situation. You look at the economy. The president was able to tell us that they're going to expand investments in SADA to provide for irrigation. We're going to bring 100,000 hectares under irrigation. SADA works under the office of the president. They supervise the stealing of about $25 million. As we speak, it hasn't been, not a peso has been accounted for. SADA has been turned into a vehicle for create, loot, and share. And then you say you are still going to continue because the people who have supervised the create, loot, and share, where you go and take $9 million and give it to one individual that should go and do guinea fowl business. And then that same individual, you go and take another $18 million, you go and create a forest. Under the office of the president, under the nose of the president. We haven't finished with that. Then you say you are still going to put in more money to go and irrigate.
He's looking at, in the economy and industry, he's looking at reviving the feasibility of reviving all Nkrumah era factories. And he's shown you promise in that area. He's already in the business of reviving these factories.
What is the track record? In the last 8 years.
But sorry, that's rude. I'm so sorry. But you moved us away from what you set down for us, haven't you?
Which is that?
Part of the economy.
He said 3. So economy,
health, economy. And he's dealt with health, he's dealt with Agric, and he's now on the economy.
Yes.
I'm sorry.
When you look at the track record, the president, this government, in the last 6 years, they've gotten 3.3 billion from oil alone. Free money. You look at investment into industry. They've built a factory in Commander at $35 million. And even though the factory has been built at commission with fanfare 4 or 5 months ago, we haven't seen a grain of sugar made in Commander. But let's leave that.
I think now what they're doing really is they're looking for a private partner to come in and to take over its operations.
Yeah, but that's why they can't produce 1 cube of sugar. Because the factory has been commissioned. Let it work and look for partner. Isn't that what you do? It hasn't produced 1 grain of sugar.
I'm not sure about what you're saying, but of course we have seen evidence of sugar produced from that place. So
you have seen sugar.
Let's stay on the fact.
No, on the market.
On the market, I am not aware. But we have seen.
Where were you aware?
We have seen persons, including the communication minister, go there and show us bags and very nicely finished sugar in containers.
Yes, but not on the market.
Right.
That's an extension.
I haven't gone to check on the market. I can't say that.
Was the factory set up to produce sugar for the communication minister to go and look at?
No, because you were saying nothing was happening.
But what
you have to show you the evidence.
The factory was set up to produce sugar so I can go and buy it instead of buying imported sugar.
Not for publicity standards.
Not for publicity.
Well, I'm telling you also that now they have announced, they have advertised for a public, venture, so to speak, to get someone to come in and to take over the operations and do a good job.
That the factory is completed. It has been commissioned. So let it be working whilst you seek investors. That's what I'm saying. For us to know that you are serious. But the factory has been shut down. The new factory has been shut down. But beyond that, so I'm saying to you, the record.
But other Nkrumah factories have been revived. Not that.
But the record is that you've gotten 3 billion from oil alone.
Okay, and you should be concluding.
You've put 35 million into Commander, another 20 million into Kumasi Shoe Factory. That is your track record. Now you are telling us that Nkrumah era factories are over 300. Now you are telling us that you are trying to go and see how you can revive 300. 8 years, $3 billion in oil receipt, free money. You can only invest less than 100 million in industry.
Now,
and they are
George,
telling us this.
Now, George, I've heard also the MPP's man in charge of agriculture subsector, Dr. Afriye Akoto, suggests that the president is being misled and we ought to be very concerned about that on the issues of cocoa production and coffee. the president says that cocoa production was increasing, was up. He said that is a lie, because that's not the situation on the ground. When it comes to coffee, he said, among other things, that the president, for example, was saying that there was going to be 4 million seedlings that were already being nursed, and that 6,000 metric tons of coffee are currently being produced in Ghana. And the MP says that 6,000 metric tons of coffee was currently being produced in Ghana. And the MP says that, government is also saying that there will be, the volume of coffee production will be increased to 100,000 metric tons as a result of government's policy to increase coffee production. Now, 100,000 metric tons. The MP says the facts on the ground do not support this. The president does not have his facts. And again, the fact that presently we are doing only between 3,000 and 4,000 metric tons of coffee exports in the country. He says that you need at least 200,000 hectares to be cultivated over 6 years, 4, 5, 6 years, and that in that period, you have to spend about $10,000 per hectare. And so, what the president is talking about, obviously, he's unaware of what is going on. We are doing between 3,000 and 4,000. He's saying we're going to do 100,000. And we don't even seem to have the money for it, because the money that goes to the Agric subsector alone, the Agric subsector alone, is very much less than what you expect to go into to give us the volume that he's talking about.
Well, I smile away because I think that is somebody's view.
It's not view. He's speaking to facts.
I am saying to you that is somebody's view. How many times having Dr. Afriye Koto right? Koto Afriye.
Yes.
How many times has he said things that we've proven to be wrong?
He's also in this production.
I am saying that I sit in parliament with him. And every time he brings out some of these things, we debunk it easily. So I am not about...
Okay, debunk
I
this
am
with
saying
the
that
figures.
The president has given you the figures. I do not believe that when it comes between Dr. Afriye Koto and the president, the person who has capacity to have correct figures will be Dr. Afriye Koto.
So what are the cocoa figures?
I am saying that... Listen, Nana, please. I am saying that...
Give us the figures.
He is an opposition MP, and he says things
give us the
to
figures.
make us look bad.
That's
what he does.
Give us the cocoa
He
figures.
has a track record of doing it. He has sat on this program and said things that we've come to debunk.
Like what?
They are talking about Agric. Even recently, he said that Agric was growing in a negative, which wasn't true.
It was.
Please,
it was. You are not being fair.
True.
You are not being fair.
In 2015, Agric was 3.6.
Yeah, but
go and check.
Yeah, but the estimate.
No, go and check. We are in 2016. We haven't had the final figure yet, so you can't be talking about that. We've had quarter one, quarter two. But please, you are talking about estimate. We are talking about real figures, Nana. Please, let's stay to the facts. So I am saying that he is not somebody I choose to believe. I choose to believe my president because I know, and I've seen evidence. If you come to my constituency, I always want to give you what I've seen. When you get to, the place, when you get to Dainu, in Bakbo, where the bridge is, you look on your left and you see seedlings. We are doing about 1.5 million seedlings of cocoa that we are giving out to young farmers to go and plant. Incidentally, I didn't even know, but apparently coffee also does well in the Botoku, Churupe area. And so if the president is talking about our capacity to increase coffee production and getting youth to take Agric as business, I think that he is on the right track. So he knows what he was talking about. And that somebody coming to say the president is being misled is not something that I believe that we should take seriously. Unless, of course, Nana Komia comes and gives me contrary facts. Clearly.
What is the cocoa production
I am
figures?
saying that president is saying that cocoa production will be scaled up. And
from 1 million.
Please.
That's what is your manifesto.
Nana, please stop. Can we keep to the
the
structure of this discussion?
An old manifesto. You are talking about.
So we are looking at your record.
2016, please, Nana. Please.
Nana, can you make note of anything
but
that he's saying that you want to react
to? An old document.
Okay, so do this. Ignore him. And
so I'm saying that the president is giving you reason why he believes that we are going to be able to scale up cocoa. He says that, look, contrary to what we used to do where Agric was in the hands of pedestrians and therefore you couldn't get, they couldn't get equipment and things to do. He said, we are doing Agric mechanization center in every district where you could go and hire a tractor or you could get a tractor to plow for you, sometimes on shared crop basis. And he gave various, even with cocoa. He's even saying that we are going to get the land for young people to go into cocoa where there will be it will be shared between whoever does the investment. And I think that these are innovative things that we should support the president to go ahead so that our cocoa production will, our grape production generally will increase. Nana is talking about food imports increasing. I don't believe
food production going down.
Yeah, because we've now doing at least our local rice from an evidence show that we are eating more local rice. We are producing more local rice, and we are producing one or two other things quite well. Bottom line is that, you see, all these things will not happen in a day. So if you have a president who has a vision, who says that, and I told you earlier on, I am aware that 1,000 tractors are already, I thought last month they were supposed to have been coming in. I don't know if they are already. 1,000 tractors. So at least when he talks about mechanization centers, already there is work in progress. So the evidence on the ground is that the president knows what he's talking about. He knows where we are with Agric. Nobody is saying that we've done fantastic with Agric. And therefore, that is why he kicks in and says that let's invest in things like SADA. Large hectares of land should be irrigated. And we are using SADA as a vehicle. SADA have been rebranded. And we've had challenges with SADA. Nobody can run away from that. But we have rebranded SADA. And most of the challenges that we used to have been ironed out. I sit on the Public Accounts Committee. I have interacted with SADA. And we've had, you know, that there was also a workshop for MPs who come from the SADA area as to the new things that they are doing. So really, things are happening. If Nana and his team are oblivious, they should say so. But on the ground, the president knows exactly what he's talking about. Agric is being given all the attention that it deserves. And we believe that given the impetus that the president has to deliver on Agric, we are on track. Now, to health. We are expanding health infrastructure. Now, I will be the first to admit that we may not have all the midwives to cater for all our CHIPS zones. But you see, I always say that when issues like CHIPS zones are being discussed and people think that, oh, they are just for politics. When you live in Botoku, and you walk 7, in fact, you live in Brother Tony, you walk 7 miles to Botoku before you take a taxi to Anfoga Hospital. Then you understand the reason why a chief zone should be very close to you. Even if he has one untrained doctor, at least your first aid is guaranteed before you move on. So let's not use Accra as the prototype and assume that Accra must get everything it deserves, or all the cities must get everything they deserve before we pay attention to the rural areas. We are enjoying by our constitution to have holistic. And I am happy. I am happy that the president is telling you that between 2009 when he took off to now, we've moved from 500 midwives to 2,000, and many more are being trained. Nursing training facilities have moved on from about 60-something to over 100.
But they are not employed.
Please take your time. But you see, as I speak to you now, something I hope you are aware that clearance have been given for many more nurses and many more teachers to be employed. Because we haven't pretended that it got to a time where we are not just employing, because there must be money to be able to pay. And you know all the backlog issues, the issues we have the single spine and things like that. Thankfully, they have been virtually cleared. There are a few bottlenecks as we begin to hear some 1 or 2 professional groups talking about premium. But by and large, the challenges that we had with single spine have been cleared. And therefore, many more opportunities being given to those who are. And then in the past, you remember that in the past, it was easy to employ nurses because we were only employing from traditional nursing training centers. Now, we have many more private institutions churning out nurses. So now, we would have to do an integrated system where government would now know that this year, this number of nurses are coming up. And we may have to, phase them out and see how you provide employment opportunity to all of them. And that goes for teachers, that goes for everybody else. So we are not pretending that we are all is rosy. But the president is giving you a roadmap about how he intends to resolve these issues. With the NHI issue, all the president is saying that, look, it's clear, and we've had that briefing as parliamentarians, and I'm sure that it's been in the public domain where we are saying that unless we get additional sources to support the NHIA, we'll have problems.
But the one that already there, we are not using.
Nana, you have already misled this house. You see, you are my senior brother. I don't want to hit you too hard, but you have already misled this house by talking about 8 months arrears. Go to NHIA and find out. They are not more than, if it's at worst, it may be 2 months, 3 months. So don't be talking about 8 months.
I am telling you,
please,
8 months.
No, Nana, I'm challenging your 8 months, and I'm telling you that it will not be more than 3 months, if ever.
So he is setting. You are not setting.
No, I am saying that it's 8 months is not workable at all.
So why are they threatening to
you
go
are
on strike?
approximating. He is setting of what he's
nobody
saying.
has promised to. Nobody has threatened to go on strike. I don't know where you get your figures. All I'm saying to you is that we have, in the health sector, the president has shown that he's retooling the millions of dollars have been set in retooling all the hospitals that you can find. Now, many of the services that people fly out to go and get, you can get at least a sizable amount of that locally here, and we are moving on. All these additional hospitals, state-of-the-art Legon Hospital, state-of-the-art Accra Regional Hospital, which we used to call Rich Hospital, Maritime Hospital, all these facilities, the second military hospital and things like that, are things that will kick in at a certain point. They are work in progress. We believe that healthcare will be brought better to the doorsteps of our people when we have finished all these projects. And I don't believe that anybody will come and say that many more beds in our hospitals, many more health facilities in our hospitals is a bad thing to do.
Okay.
President is only saying that, look, because of the challenge that we are having with the national health, and because the numbers are increasing, we are saying that some of this oil, annual budget funding amount from the oil revenue, he is proposing that a certain percentage should be used to support the NHIA, so that they, whilst doing that, we also admit that there are some fraud in the system, there are challenges in the system. Whilst we correct those challenges, this comes on board to make our health situation very good. I think that I'll go to the economy in the main.
And do a minute for me on that.
Something. I have sat here and on many programs I said to you. Have we had economic challenges? Nobody can pretend we have. We've had energy crisis that has had effect on the economy. Our traditional goods have not done well. Our imports, it has not been as good as we had wished. And therefore, those are all economic challenges that we try to correct. Our deficit has slowed down. And we are getting on board. And the president has given us a picture where he says that from 2017, looking at all the things that we are rolling up and kicking in, the economy can only get better. The indications or the indicators are that we are gradually getting out of the woods and we are getting into better times. And so he's promising better times ahead with the economy. I think that these are not things that anybody should poo-poo and shoo-shoo away. They are realities on the ground. There are works in progress.
Right.
There are, when you go to Legon, you will see the hospital. When you drive past, you will see. These are things, and compared to others who are just talking, we have evidence on the ground. And we are only saying that it's going to get better.
Right, you're still here on Newsfile, and this is your most authoritative news analysis show, brought to you by Bank of Africa, also brought to you by MTN, Star Assurance, Having Mosquito Coil, ACAP Compost Fertilizer, White Temple Agency, Ines Fly, and Royal Lighting. Now, Kuku, I don't know which areas in these three, broader sectors catch your attention on the highlights. The NPP already has said this thing about cashew marketing board is stolen from them, and they are referring to various aspects of this that have been stolen. After this show, we'll be bringing you the coverage of the Manifesto launch in Sunyani.
Well. I am not very comfortable with the narrative, the words, things about stealing, copying. I'm not too sure whether these are precise descriptions of actually the way our development history has gone and how various parties and governments have tackled some of these issues. I'm not too sure the language, whether it's an appropriate one. But see, and what I'm going to look at is the tying of the petroleum, the national health insurance thing to petroleum receipts.
Okay.
Of course, I don't have the specifics, which area of the petroleum revenue thing that is going to be targeted, what percentage. I'm sure those details may be worked out, or maybe we'll have some greater appreciation when we see the full document, how they're going to go about it. But the principle, I am for it. And it only surprises me that sometimes we have limited in terms of our memories, you know. Your own station reported this thing. This is November 25th, 2012. Oil money will cater for free SHS and health. Akufo-Addo. Nana Akufo-Addo made a point that he was going to use part of our oil revenue to fund the free SHS and health.
After his controversial BBC interview.
Yes. You see, Nana Akufo-Addo reiterated his plan for education and health, the two key sectors he will spend most of the oil money on, as spelled out at the IEA debate last Wednesday. He believes this is the best legacy Ghana can leave for the next generation when the oil and gas run out. I can tell you that there were people on the side of the NDC who thought that was not a wise thing to do. And indeed, we even thought that there would be serious constitutional obstacles and things. Not looking at a principle, even if there were going to be constitutional obstacles, who said there could not be amendments or review or re-engineering in order to ensure. And in the same way, today we are being told oil money could be used to help the insurance scheme. I'm for it. The truth of the matter is that it's hugely challenged, that scheme. I don't think it's collapsed. I think it's hugely challenged. And that if you are not careful, it will be eventually just be there in name.
Other countries have been coming to Ghana to study this because it's a success story.
It is relatively a success story. Very positive, very positive scheme for this country. But it's challenging its implementation, in its operationalization. There are people who go there, and I've spoken to some, they get access all right, but they end up also footing the bill for the medicines and things they are asked to go and buy. That is not a serious health insurance scheme then. And if you don't cure that mischief, it can lead to its collapse eventually. So I agree that is hugely challenged. Something ought to be done about it, and clearly it had come to the funding. Yeah, the president spoke about the auditing, the cutting out the fraud, all those things are important. But at the end of the day, you needed a sustainable line of funding. And what is it? The oil is our resource. Part of it could be useful, but I've said that I don't have the competence to give the details or to how it should be done. I believe there are people out there who can do a better job when it comes to that. But I accept the idea. And I won't say that's copying or stealing. I would say that's an belated acknowledgement that indeed that resource line is available to be used. You see, so let's cut out this.
Just 2 seconds. You know, this stealing matter, just
sure, no, I don't have a problem if the host
when
allows.
Somebody comes up with an idea and you take the idea because you believe it will be useful, there will be no problem with it. But when you say that we want to create another region for the Western region, and you are told by the Deputy General Secretary of the NDC that what you want to do is a very bad thing, if you want to divide not just one region but the whole country.
No, I don't know why you still want to start this debate ahead of the topic. We're doing that after here,
it should be resisted.
So reserve that when we get
then
there.
When you go back for the same thing,
so continue. Sorry,
then it's stealing.
Nana, thank you.
One more.
It's okay. No, stop.
This
we'll
Cashew
get back.
Development Fund, as Seydou Nketia said, it was a bogus idea. So Seydou Nketia didn't know that this was going to be part of the NDC manifesto.
Thank you. Now,
so when you come out with somebody will say you've stolen it.
Maybe if the NDC had earlier on thought about the oil money, they would not have scrapped the earlier idea of a one-time premium.
I'm not sure even if that would have been sustainable in the context in which we are talking about. If you go back to read what they claimed they would do and all that, I'm not sure.
Okay, so
I don't
continue.
see that as an alternative to this oil money thing. After all, it's not just going to be exclusively oil. There's still some other sources of funding, so it's a complementary rather than exclusive. No, so it's still the same principle. Akomia was pushing us to jump the gun, but my point is that let's see a belated acknowledgement of the viability or feasibility of an idea.
After it has been condemned.
Those who condemned are people you can checkmate. And I did it last Thursday. I see what your drift, but that's because we haven't reached the region matter. Okay, you're pushing that whole thing in here. But I'm saying that in terms...
No, I use it in terms of the stealing.
Yes, well, I would use that language. I'm not sure. Because you see, look, if you go back then, there are many projects, many concepts that predated the NPP's administration that came on board. In fact, I keep on hearing the PNC people saying that the National Health Insurance is their baby. I don't know if you've heard them.
Yeah, I have.
Yes, that they put it out there. But even though, historically, you can go back and see that in the Second Republican Parliament, some of Bussia's MPs were advocating that.
Okay.
Yeah,
but they didn't condemn it.
No,
when you condemn later you go and take.
I am with you on that drift. That would have been a position I would have articulated if we had come to the regions thing, because I read whilst I was out there somebody saying that the one region thing that I was talking about was divisive and indeed even secessionism. And of course there were all those who also some who came out and said, look, we're already thinking about it. So there was a split language.
Even we are moving there. So you've dealt with a bit of health, Agric, economy together.
Yeah, and the economy is quite intriguing, but that's what we do to ourselves as a nation. Again, it's debatable. Revival of the Black Star Line, we supervised this liquidation some years ago. This Aboso glass factory, I found it very interesting. We also supervised this liquidation. We're going back to look at some of those things. Yes, not all. So many of those things have been divested, some were liquidated.
Right.
And I'm not sure it will even make economic sense to go reviving some of them now. The challenge, the burden that it will pose may not help even you to do your microeconomic things properly. I mean, I'm sure Kudo will know better than I do in that sense. But you can focus. I was for Commander Sugar Factories rehabilitation. I have to be honest with you. And I'm still for it in principle. But I think we have to be honest to admit that perhaps we didn't do the synchronization well. Because if you've commissioned it, there's no sugar on the market. And it is now that we are looking for private sector participation. In terms of sequence, I think there's something.
No, but it was propaganda. Good for propaganda. There's something wrong
with it. But it's not too late. It wasn't tidy, but the factory is there. It has the capacity to operate. If it gets the private sector intervention, it may help. I'm for it. It's like the Kumasi shoe factory.
Right.
I read in Graphic not too long ago there's a commentary that the management had passed that even the directive given by the president that the security services should be procuring their things from footwear and things from wasn't being met, wasn't being done. And there were still state organizations were still going to China and elsewhere. Now, if we keep on doing this, you can rehabilitate or revive, and yet the thing cannot be sustainable. And so we have to be careful.
So was that a suggestion or a directive? Because if it's a directive, it ought to be complied with.
So there's something wrong there. It means on both sides, the security services, I would be surprised if it was just...
yes, some people must be doing some explanation to the president then. Yes.
So that comes back to whether indeed just rehabilitating is okay, but making sure it works. The gold refinery, it's a positive idea. There are many of those things are positive. It's whether indeed they can be properly sustained. I mean, revived and sustained. I don't know if you want me to go into the regional thing, but
we will deal with that
yes.
shortly. We'll deal with that shortly. Let's hear Kojo on the questions of Agric and the health and the economy as well. And I know your major interest is in governance, but let's deal with this and see.
No, I mean, I think, first of all, and I mentioned this at the beginning, that we really have to manage expectations about the economy because the challenges are significant.
Okay.
I read the minutes.
You mean we shouldn't do propaganda?
Uncle is trying to put words in my mouth.
I have to be clear.
You read the minister's
the supplementary budget.
Okay.
Where, we are currently under an IMF program.
That's so.
And there are things that we are expected to achieve as part of that arrangement. And all the strategies to deal with debt management, which is a serious issue, because the repayments puts a burden. Basically, we are borrowing money to pay our loans. So you get into a debt trap. You don't have any fiscal space to do a lot of things. So it's very tight, even paying salaries. And remember, our wage bill is also huge. If I remember, it's still about 10% of GDP.
We're going to expand the oil refinery to 200,000 barrels per day of crude.
And we know the toll debt
we are going to have an aluminum plant to be set up also in the country. All of this will help.
I mean, for me, as I said, the first thing, and that's why, it's one of the, I would take Koku's advice about getting more meat on what the strategy is to deal with the short-term macroeconomic, and it's not even short-term, it's a short to medium-term macroeconomic challenges. Because if you don't deal with that, you cannot start talking about financing all these issues. You talk about NHIA. Remember, we are also taking a percentage of the oil funds to fund the infrastructure fund, right? And want to do the same thing with the NHIA. The challenges with the NHIA is that we are pushing up enrollment at speed, but in terms of who actually pays for the NHIA is those who are on Social Security, VAT, and so on. And because of the challenges we have in the economy, a lot of those statutory funds have not been remitted as expected, even to District Assembly Common Fund and so on.
Right.
So it's very, very tight. And it's not going to immediately get better because if you are relying on oil, you can't rely on the price. At the moment, the way we are using it, gold, oil, cocoa, that's a problem. So I'm hopefully when the manifesto come out, we can get a better sense of how that's going to be dealt with. The issue with industrialization, all over the world, now some countries have shown that state-led industrialization is possible. Brazil, China, India. A lot of the big billion companies in the world are state-led. We have not shown to be able to do this and do it well because it requires a certain discipline. You have to keep your hands in your pocket. You have to think like a business person. The developmental states, the Asian tigers who've done it, Rwanda, that's doing some of it. The discipline you require to be able to do these things, and it's not, I'm looking for the word, but it's not easy. For a factory, when they were trying to buy back the tomato, they were competing with the market because you have, if the farmers feel they can go and sell it and get a better price, they will collapse. You're not going to be able to buy at that price. All of these things are a feature of feasibilities. and your business plan, and whether or not you have the business people to take that forward. Other countries have done it, as I said, and they've done it successfully. So it's not that it cannot be done. It's whether or not we can show that we can do it. And so far, for me, I'm not convinced. With the ones, really, even the ones that we have started. So the question is that the model? We're talking about Black Star Shipping Line. For shipping, their cost, their risk. Why is it that there are not so many Ghanaian business people in shipping? Because the capitalization that you need for shipping is not an easy thing. For any state...
Kojo, the shoe factory even provides you with a ready-made example, not even the shipping.
Okay.
Where the factory has been set up, the military, the police, and they will not buy.
Yeah, but that's what I'm saying.
So it's even a better example.
For me, we have not shown, and so I wouldn't go for that model, rather to expand it.
That may have informed why the NPP's one district, one factory is hinged on private sector. So it's going to be PSPs.
For me, as I said, our history, our specific history, tells me that
we're terrible at this.
Maybe there's so far, I'm thinking of a very successful parastatal that branch, maybe in the insurance, maybe national
this is not within the context of a PPP eventually.
Well, there's
didn't I get an impression that you launch it using the state interventionist approach, but sooner than later you divert it? Is that not the idea?
Whichever, like
I'm just asking. Is that not a blend?
There's some
like Commander has just been
some
launched,
of the
and
power,
we're looking for private.
Some of the power sector,
some
of the power sector arrangements have that combination. But whichever you do it, whichever model you do it, what I'm saying is that strategy, we have not learned how to do it well, because we always...
But Kojo, where I agree with you.
I'll take a break so that we return.
Just to do something. But you see, the countries that you've used as examples is where I have a problem. You're talking about Rwanda. But you see that Rwanda has a certain political arrangement, and that kicks in
but that's
differently from what
but that is what I'm saying.
Kagame is sitting there knowing that I have 11 more years on
honorable. But that is why I'm saying.
No, but I'm saying that's why Kweku comes out in with.
You can take Botswana. All right. Take South Africa. There's a certain history and a certain context. But there are certain conditions that you require to be able to do this kind of state-led. And I'm saying that we have not shown, we don't have it.
You're right,
and
about that.
But that's why the strategy is different. That state comes in, once you stabilize, you kick in, we do a PPP, then you go on. So that's the strategy.
Thank you very much. And we do really need this to be ongoing. Nanado too has been talking about industrialization. Let's have their manifesto also launched, and then we'll see how it goes. I just spent a good part of the week in Sogakope, traveling from Sogakope to part of Adan to attend the Ghana Bar Association conference, annual conference. And you see the watermelons that obviously may get rotting. They are on the street, on the road, almost everywhere. The tomatoes, and you buy them for cheap. You take a whole basket for just how much? Peters. And I'm buying. And I'm looking at the ones who are selling them and asking myself, this is so unfair to them, you know? They've sweated, spent so much time to cultivate, and you're buying them for nothing. But sometimes they are just pushing them on you, because if they don't, you don't give them the little, it will get rotting. We need to be serious about these things. We'll be right back, and we will deal with the regions and a bit of governance about the Ghana Integrity Initiative's questioning about lack of a scintilla of information about corruption, how to fight it.
It's not.